1, 2. So we're here today to talk about basic routine foot care in a person that is an adult, that does not have diabetes and does not have peripheral vascular disease. We've already done an assessment and he has no known allergies. So the first thing we're going to do is just take an alcohol swab and we're just going to gently run that over the nail and the top, just to shine it up a little bit so that we can get a real good picture of where the nail margins are. The first device I'm going to use is called a probe. The probe is nicely able to grip it. It's got a good grip on it, and then it's got a blunt end on it. And basically what we're going to do with the probe is we're going to probe. We're going to have a look at the foot, and we're just going to look in between the toes, because that's where there's a lot of hot spots, and make sure we're not missing anything. We're also going to look at the back, especially on the back where we've got like that little fat pad and it meets in that crease there. A lot of times you'll notice with people that'll crack in the skin, and you want to be able to identify that for them. It's on the other side of the feet, it's far away from the eyes, so sometimes it's hard to see. We're also looking at the back. You want to pay close attention to the heel. That is a #1 spot for pressure injuries to happen. So you want to feel, because sometimes it'll feel boggy, but you also want to make sure you put a set of eyes on it. If you feel you're not able to see at this angle very well, then you can just turn your chair around and have a look. So, but I feel confident that I can see everything. You also want to look like any black spots. Sometimes those are cancer. People can get cancer of the feet. It's not incredibly common, but it's there. And that's part of your job, is detection, early maintenance, and prevention. Okay, so this foot looks great. I don't see, there's no fungal, there's no ingrown toenails. He's not told me. Usually I'll ask him, how are your feet? Is there anything that you want to tell me about today with your feet that I should know? And this person has not said that there's any issues with his feet coming into this visit today. So you can decide how you want to use your flow. I like to go from left to right, or from pinky to the hallux, or the great toe. I find where you're going to earn all your money is on the big toe. Generally, the 2nd, 3rd, 4th, and 5th toes the nails aren't too thick usually, or ingrown. Usually, #1 trouble is with the hallux, and then second is this guy here. So usually, my preferred way that I like to roll out my care is I start with the pinky, or the 5th toe, and I get all these done, and then I spend my last bit of time on the hallux. So, tool I have now is called an excavator, and the excavator has these blunt ends on both ends, and they're extremely, extremely thin. And again, they're blunt. Sometimes I will let my client touch the end because they're like, oh, you got a scalpel. It's like, no, it's blunt, feel it, and that reduces some of their anxiety. So I'm just going to check my nail edges here. Sometimes you'll see white, and you think it's okay to cut, but then sometimes it touches the skin. That one looks good. This one here, again, just checking that my nail edges are free where the margins are, so I'm going to know how far down to cut. Okay, so there's a couple different kinds of nippers. There's these nippers, if you look closely, they're very sharp and they're very thin. I prefer these, although if you've got really thick fungal nails, they might not cut so well, but for, I would say 80% of the toenails that I cut, these meet the needs. Another type of nippers is this one. I'll show them, it's a little bit thicker and blunter. So you can see it's not as pointed, and it's a little bit finer on this tool on my right versus this one on the left. This one is really good if you've got some really, really thick nails that are either fungal, overgrown, or maybe just the way, that's what they got. A lot of people ask questions, why are my nails the way they are? It's either usually they've had trauma to it, or it's just what you got. This is the way it is. So you have your nippers, and you'll see the spring in the middle. You'll see the identity and all that stuff. So you want the nippers, the writing on it, to be away from you. This flat side, if there's no writing, you want the flush side to be facing the nail that you're going to cut. This part up here is nicely grooved. That should be facing you. So we're going to start. I go inside to out. You decide. I also provide care to my clients as if I'm shoeing a horse. They're generally behind me. I do that for a number of reasons. It's where I feel most comfortable. Also, if there's nails flying, I feel that I've got my PPA on and I might be able to block some of that. And also, the third reason that I do is some people are very anxious when you're coming at them with sharp objects and nippers and probes and excavators. If they can't see what you're doing and they're looking elsewhere, that's sometimes better. Whereas if I were to provide foot care, which is a lot of people do, where I spin around the other way, where I'm on the other side of the foot, my face is directly facing the client, he has full shot to see everything. And when sometimes they see you coming with these sharp instruments, they get very nervous, and I'll go to cut and they move their foot before I can even cut. So here we go. So you just gently go from the outside. Once upon a time, they said you cut your toenails, cut them straight across, cut them straight across. Well, if you cut straight across, then what you have on the outside is like, it's like a piece of paper. You have these two sharp edges. The edges are a lot of times what give people problems. So no. So now the new rationale, the new thinking, the new recommendations is to gently round those edges. So I'm just using my dresser. And I just got these, so they're nice and sharp. This is usually if I'm going to cut somebody or do an interruption in their skin, it's with my sharp file. So generally you can do what I'm doing now, where I'm just doing one toe at a time. But generally what I do, and just to be efficient, I'll cut them all and then come back and sand them with my dresser, and then I'll work on the hallux. So I'm just going to do. Another thing you'll find is toe care. Not everybody has coverage for toe care. So they'll say, cut my toenails as short as you can. And you have to resist that. Do not cut any shorter than you think, especially do not go below that white bed. You won't be able to anyway, because as soon as you go somewhere that you're not supposed to be, they'll flinch. They know before you cut that you ought not be cutting there. So be aware of your client's response and their nonverbal. So this one looks like he had caught it on something a little earlier. Try to go with the curve of the nail versus forcing it to bend to you, because that's usually when it hurts for them. They'll feel a little bit discomfort, like instead of, rather than me even trying to like cut it all up at one time. There's no contest to be like, I got the whole nail off in one piece. There's no contest. We've got to do it little by little, piece by piece. You go right ahead. So they're all with the nippers. And so now what I'm doing is I'm sanding the corners and the surface. You don't want these to catch on their socks, or if they have nylons, or on their bedding. Nobody likes that. And even though you may have done a good job, that's what they might judge you on. It's like, well, it was great, but gosh, caught it on my pantyhose, I caught it on my bed sheets, caught it on my towel. So yeah, I'm just making sure that those corners are rounded versus straight across. Because you think of it, when they go straight across, as they grow up, that corner is going to bite into the other toe, and then it's going to be sore. It can also be more likely to be ingrown, which as a personal support worker, you are not to do any ingrown toenail care. You identify and you would refer to your resource advanced practice foot care nurse. So, okay. I wouldn't say any of his toes would qualify to have to pull out your rotary device. The rotary device is usually for thickness or fungal, or a lot of times they just have a dead toenail, like maybe they banged a rock on the bag hallux, which it usually is. So what I'm doing now is what they call dressing the toe down. When we file this way, it's nice and smooth. Think of it as a flat surface. It's smooth this way, but it's not smooth this way on the part of the nail that I'm looking at. So we want to try to smooth that so it curves a bit. So this is your dresser. This is a 6-inch. You can get a 9-inch. 6 inches enough. And I'm just gently going in a curved motion over the end of that toenail. We do not have cuticle removers. You are not a pedicurist. You are a certified basic foot care nurse in the role of a PSW. And don't worry about the cuticles. You don't have to paint them. You'll never get through your day. You are there for safety and prevention, not to make it feel beautiful. So as you can see, the first thing I did with the whole foot is did an assessment, especially between the toes and behind these little pads here. Then I checked my margins to make sure what I'm seeing is what I'm seeing, and the nail hasn't unexpectedly attached itself to the skin back here somewhere. And then I've gone and just done cut the big stuff off. And then I've come back and I filed it side to side, got the corners, and now this is the final thing, dressing them down, where you're just making sure that that nail isn't too thick on there. So this guy hasn't twitched at all, so that's a good sign that I'm not being uncomfortable. Or some people have ticklish feet. It makes them nutty. So, and you can go back and forth. As you see, like I'm looking at this one now, I'm thinking, you know what? I think maybe I could have taken a little more off that. If you're not sure how much to take off, don't take too much off. You can come back, always come back and do what I'm doing now and take a little more off. You can't go the other way around though. If you take too much off, yeah, it's too much. There's no putting it back on. So this one, as I'm feeling, it feels a little bit like the nail has grown a little bit to the skin edge back here. And that's all right. So just gonna sand this out and then we're gonna move on to the hallux. Now, while I'm looking at his foot, this person's been kind enough to volunteer for this video, but generally if I'm with a client, then I would be telling him things like, looking at your foot, the color looks good, the feel is good, it's nice and warm. You could always do your pedal pulses back there. I'm looking for any misshapen, like if there's a bunion growing here, checking for cracks and fissures. And again, I'm feeling for nonverbal movements from what I'm doing. And sometimes if you ask a question, that's great. Okay. We've got our masks on, so you can't, it'd be nice to blow away stuff, so, but you can't do that anymore. I just want to talk about this device too. This is the Black's file, and it's either curved, or this one kind of has a little bit of an angle to it, but it's either angled like this or curved, and then it has a flat edge here. And again, these tools you'll be getting on the first day that you go into your practicum, all of these tools that are here. And again, this is the Black's file and the other 4 over there. What this one is for is, a lot of times you have a little thick dirt. It can help take some of that out. Not thick dirt, could be. But what I find is most useful is if on the side you've got an overgrowth of skin, and you'll know because you won't be able to get your nipper or your excavator in behind there because this has grown to that. A nice non-invasive way to get that down is to take this file edge, either one, the straight or the curved, and just kind of rub it over that. And that just gently shaves or gently files it down so that it exposes that nail margin. So this is not used for corns or bunions or any plantar's warts. It's just mostly for these corners. And sometimes it can even be up on the top where you'll want to go in and just smooth that out so it frees up your nail edge. So I just want to check my nail edges again one more time. Sometimes too, at the beginning when I use the alcohol wipe, and again, I made sure that he has no allergies to alcohol. Sometimes you might be able to unexpectedly identify a break in the skin, because you know sometimes alcohol on a little skin wound or an opening, it stings. So that is also another reason why I use an alcohol swipe. It might identify minuscule. So he doesn't have a whole lot of nail growth here. You can see I'm trying to struggle to find any measurable. Most of them are like out to there where that blade is, and all sideways. I'm tripping on him. But this guy, you can tell, is really staying up on his nail care. And again, just going behind the blade, or the blade's going behind the nail. Now I'm getting down to the corner. You can see we're not straight. It goes straight, but we're going to round it out there. Okay. The other reason I like to have my back to the person is even just for your breath, like used breath, you know, in times of pandemic and social distancing, and trying to have what you're breathing out go the opposite direction, or what he's breathing out, you know, land on my lower back or something. Whether that's true or not, that's just something in my mind that I think might be helpful. But a lot of people will, and I will show you when we're done with this, just so you can see the position. Again, my back is currently to the client, my knees here, and it's just like people have told me I'm shoeing a horse. And you might get kicked sometimes, but usually it's only people that have dementia. And in your program, you will have another assignment, because there's a whole, it's one thing to provide foot care to someone who wants it and understands what they're getting. It's a whole other thing to provide foot care to someone who doesn't want it, doesn't really understand what you're trying to do. Different techniques. So I'm just going to go one more time with my excavator here, just to make sure I don't have any uneven edges there, because sometimes they'll hide in the corners. And your guide, client will leave feeling great, and then maybe 2 days later, like, oh, I kind of got this, my one corner there, by the time it starts to grow again, right? And again, the dressing over, just think of this motion. And again, when you filed it this way, this is the top of the edge there, you've made it flat. We're working on this sharp edge here. That's out. His toenails are not very thick, and I'm sure in some of the program content you will see we have examples of real life toes that our clients have given us permission to share with you, and they are quite something. Yes, I'm just cleaning it up. Okay, so then I take my probe, I kind of start with it and finish with it, and then I'll go in between, and I'll kind of use the back end of this, because as you're providing care, and especially when you're doing the filing, some of your shavings will go down in between their toes, so we just want to kind of spread it and get that out. Yeah. So yeah, I think they look great. So I'm going to just spin around. I'm going to move my equipment here and just spin around just to give you an example of. And surprisingly, a lot of people will say, I'm sorry, is my foot heavy? Is my leg heavy? And I've had 600-pound people, and I don't know, there's something with the legs, it doesn't seem to bother your legs, but you'll find out. So yes, this is the other view where I'm now face to face with my client, and you know, again, I can see under here because I was looking at the other side this time, but yeah, I think it's about half and half, 50-50, do the, like you're shoeing a horse, and then the other do it this way, like the other guys tell me, like I'm milking a cow. And both are different, but no wrong answer. It's just what's comfortable for you. So that's the basics. We have other sections where we talk about what is in your scope of practice and when to refer to your resource advanced nursing foot care person. And at the end, I will often ask them if they have non-medicated, non-perfumed cream. I'm more than happy to rub a little bit in their foot, and that just is good for circulation. It makes them feel good, and a lot of times I find most clients will tell me that's the best part of the visit, that just their feet feel so good. And we want to give good care, we want them to feel good. So that's the end of that. The only other one is we'll be asking you to make sure that you do your documentation, and I think that's it. Thank you very much.